month's. Well, yeah, welcome everyone to this month's virtual Spark session. In sort of light of the pandemic, we've tried to translate these instead of fully opportunities for us to all hang out and drink wine or coffee on the department's budget and find a way to collaborate with each other. We've been trying to use these into useful training opportunities. So for today's, we're starting a series in thinking about kind of riffing off what we did in the fall, both communicating but also interacting, and how to best practices for working with community groups and communicating results to the public. So we've got a very cool set of speakers today, which I'm excited about. And so the first is Robin Dodson, who is a alum of the Department of Environmental Health program, made it out alive, and is now working at Silent Spring Institute, is still collaborating with lots of folks here, and is doing some very interesting work. So he's first going to talk about her taking stock study, but Robin will let you take it away so that me talking is less useful than you talking.
So yeah, Jamie, I think I need to be able to share.
Should be good. Thanks, Eileen.
Okay. Okay, so there we go. I just, so when I was talking to Tamara about this session, she thought I should just kind of focus on and just wanted to hear a little bit about kind of the process of doing community-based work. And this idea here is this is not going to be a very formal, presentation with a lot of citations and findings and things like that, but more just kind of talking about kind of why we do this work, and why it's important, and how we do it, for any folks that are interested in trying to embark on something like this. So and I'm going to use a study that I'll introduce. It's called the Taking Stock Study, as just in kind of a case example here. Of course, there's kind of several others, and I'd love to hear examples that any of you have in your work, and we can talk about some of the methods there. So I'm going to first actually start by telling you a little bit more about Silent Spring Institute, because in fact, we were founded by community members. We were founded over 25 years ago now by activists in the Massachusetts Breast Cancer Coalition. These Massachusetts Breast Cancer Cancer Coalition was really interested in trying to identify the problem that they were seeing on the Cape was that there was really elevated levels of breast cancer on the Cape relative to the rest of the United States. And Massachusetts consistently ranks kind of on the top 5 in terms of breast cancer cases in the country. So this is really concerning. And when the state and others had done an analysis, they found that traditional risk factors for breast cancer couldn't explain these elevated rates on Cape Cod. And so the activists of Massachusetts Breast Cancer Coalition, actually, that's them on the left there, kind of, they had a rally at the State House, and they were able to secure some state funding to start a research institute of their own. And then it was termed a lab of our own at the time. The idea is that they looked around at the research on breast cancer risk factors and found that nobody was really paying attention, besides the Long Island breast cancer study, nobody's really paying attention to the environmental contributions to breast cancer. And there we were. So we were launched with some state funding. We no longer rely solely on state funding anymore, but the idea there is that we were founded directly to meet a need or a want of community members. And our research now, we've moved beyond just thinking about breast cancer. We think about the environment, women's health more broadly. We're well beyond just thinking about exposures and breast cancer cases on the Cape, and think about them kind of are involved in national studies. So, and actually I will kind of point out the woman on the right there with the glasses, her name is Cheryl Osimo. She's actually one of our founders and is actually still works for Silent Spring. She's an outreach coordinator on Cape Cod for some of our PFAS studies down there right now. So, it's a long history of having community voices within our institute. So I'm trying something new for me. It's a Jamboard. And this, I created a tiny URL, but I'm told, yep, it'll go into the chat as well. And so on the Jamboard, I'm going to kind of pose these questions and thinking, while you're listening to me, you can put up like little stickies and maybe talk about some of these issues. This is the first slide. I'll go ahead and kind of keep chatting while you're kind of in the Jamboard, and we'll come back to that as kind of during this discussion phase. So the first thing I pose to you all is, what are some of the barriers, perceived or real, to conducting community-based research, right? So what are maybe some perceptions that people have around kind of, it takes, I don't know, maybe I shouldn't give it away. Takes too long, it's too hard. I don't want to interact with anybody else on Zoom anymore. So, if you have any thoughts there, feel free to drop them into the Jamboard, and we'll revisit them towards the end. So now I want to talk a little bit about a study called the Taking Stock Study. This is and I feel kind of honored to represent it because it is truly kind of a collaborative project. It is, not my project. It is a project of many, and it is a community-based project that was kind of born out of some real concerns that some community members were having, specifically Black Women for Wellness in LA, around some of the observed exposure and health inequities that are observed among Black women. So first of all, just a little bit of motivation for why we kind of started this work. So we know that women of color and Black women more specifically are disproportionately exposed to many consumer product chemicals. So on the right here, I'm just showing methylparaben concentrations. You could look at several different of these examples, but showing that non-Hispanic Blacks actually have higher levels of methylparaben in their bodies if you look at the National Biomonitoring Program and HAIDS. Methylparaben is a preservative commonly used in many personal care products, and it has been shown, at least in animal studies and lab-based studies, to be estrogenic. Many of the chemicals that where we can observe inequities are endocrine active, and we know that also that women of color face disproportionate burdens of several health conditions that are also related to hormone mediated, so like uterine fibroids, preterm birth, diabetes, asthma, immunosuppression, and of course breast cancer. And we know that consumer products are important sources of these exposures, and these are what may be leading to the disparities that we're actually observing. So here I'm actually putting forth a kind of a framework of two Taking Stock collaborators, Dr. Amizoda, who you've heard from before on some of this work, as well as Dr. Bhavna Shamasunder at Occidental College. And they published a kind of a commentary trying to put forth this framework of thinking about the environmental injustice of beauty. This idea that there are upstream drivers that are influencing product choices that are really, quite honestly, kind of entrenched in kind of racialized beauty norms, right? So this idea of colorism, in affecting whether or not women need dark or light skin, hair texture preferences and the use of hair products, and of course, odor discrimination for the use of kind of other vaginal products or others to kind of hide the feminine odor. And this is a nice framework to think about it because it kind of shifts the focus away from just thinking about it's happening at an individual level, but really trying to move it back upstream to really think about what are kind of the systems in play that are kind of setting the stage for these inequities that we're seeing. Another part of the work that, another part of our research that kind of motivated this work coming together and taking stock was a study that we actually published a couple years ago that was an extension of some previous work that we had done looking at endocrine disrupting chemicals in hair products that are used by Black women. And very own Tamara James Todd was the one who told us what those products were based on her work in New York City. And we analyzed these hair products, 18 different ones for a range of EDCs, including with parabens, phthalates, UV filters like benzophenone 3, cyclosiloxanes, of course, and some things like fragrances and ethanol amines and alkyl phenols as well. And we found these, every single product that we looked at had some of these chemicals, between 4 EDCs to 30 EDCs in any one of these products. And what we take away here is that women are not using these products in isolation. They're likely using many products at a time. And this is just part of a beauty regimen, perhaps. And this is really just, it's not directly, finding a cause for the observed inequities that we see, the observed exposure inequities, but it's kind of putting the pieces of the puzzle together. And this is just one piece to help put those pieces of the puzzle together. So another thing, another piece of research that we have done that's kind of helped to try to motivate some of this work and why we designed the taking stock study the way we did, which I'll talk about in just a second, is that we know that product use increases exposure. Now, this is kind of like a no duh, right? Like the idea here that with more product use that's happening on the x-axis, you're going to have increased, say, paraben concentrations. That has been seen before, and that's really important. But this is actually an analysis from our crowdsourced biomonitoring study that Silent Spring did. It's over 700 people mailed us urine samples and filled up questionnaires. And what's important here is that we could see significant differences in exposure among those people who scrutinized the product ingredient label. What that means is they flipped it over, they checked for, does this product contain parabens? And if it did, they would not purchase it. They had a preference towards avoiding parabens. And the result was that they could significantly lower their levels, but they can never go away entirely, right? We still found methylparaben, for example, in every single urine sample that we analyzed. And that's because personal actions can do a good job, but they can't do everything, right? They cannot completely drive those exposures down to zero. But what's important, it means that behaviors, personal behaviors will influence your, not only in the products that you use, but also in your attempt to avoid chemicals will influence your exposures. So taking that all kind of together, as well as some kind of, I guess, conversations that I've been having with Jan Robinson Flint for a very long time around just her concerns. She'd been doing a lot of work. She's the executive director of Black Women for Wellness in LA. A lot of work thinking about exposure inequities. She'd done a lot of work with hairdressers and hair salons in the LA area, and really wanted to try to bring some research to some of those questions that she had. Why were we seeing these higher levels? Why are these products in particular being used or kind of marketed to women of color and so forth? And so this is a community-driven, the Taking Stock study is a community-driven pilot study that was guided by the overall hypothesis that consumer product use patterns contribute to exposure and health inequities among women of color. It is very much a collaborative project. It is headed by both Jan Robinson Flint at Black Women for Wellness, and the research PI is Bhavna Shamasunder at Occidental College. There should be some other familiar faces here, including Marissa, who was at Black Women for Wellness at the time that the project was launched, as well as Ami Zoda is in that. Karen Michaels, too, used to be at Harvard. And of course, there's several now who have kind of come on since we took this picture at our launch meeting. So I want to pose another question for the JAM board for you all. What are some ways to support equal partnerships between researchers and community members? I'd love to hear kind of like brainstorming on what's worked. You could identify things maybe that didn't work too. And I'll talk about how our approach for this particular project has been, is generally. So here, just real quick, are the aims of the Taking Stock study. The first is to do a broad survey of product use across California among many women, premenopausal women across California. The second aim is to really do a deeper dive among women, Black women and Latinas living in South LA. And then the third is to kind of pull in some product testing to try to support some of the concerns of the community members. This actually, the product testing in particular was something that Black Women for Wellness was really interested in, because that can be really effective to support kind of campaigns and other work that they want to do, outreach efforts they want. So real quick, Lisa will actually summarize some of this in her work. We found that in general, women reported an average of at least 8 personal care products per day. That's of the 54 we asked about. Some women were using 30 personal care products a day. We found significant differences among our different groups that we looked at. This is survey data, I should say, where we found that Hispanic, Latinx, as well as Asian women tended to use more cosmetics than other women, whereas Black women tended to use more menstrual intimate products and hair products. Again, these are the products that we asked about than other women. And the largest differences when we looked kind of at each different product type was among Black and white women, and we saw 28 product types that were different among our different groups. Another interesting finding out of this is that 70% of women reported at least half of their products as being scented. And this is really an issue. This actually has become a real issue in thinking about interventions around it. People are attached to their scents, and this is a kind of an issue now. We're talking actively with kind of community members around what is the best way to kind of get at that, and kind of pivot people hopefully away from using scented products. But that's a steep hill to climb. We also wanted to get at some of the drivers of product use. So here is we asked women why they choose the products they choose. Is it the brand? Like, do you just love a certain brand? Is it the effectiveness? Do you look at ingredients? Is it price? And I think what's interesting here is that people are not as kind of don't necessarily stick with one brand over time. And that's good, because to me, it seems that means that people are pretty flexible in what they might use, and that rather it's more about price and effectiveness. So if you were ever to design an intervention, you could identify those products that were equally effective and a similar price point, and it might be effective. The other question we asked about was, where do you go to learn more? And overwhelmingly, it was friends and family. Which was really important. Again, thinking about moving forward and designing an intervention, you would do one that is well supported by family and friends, right? That you have kind of buy-in across people's networks or communities to be most effective. So this is actually summarizing that second aim. This is actually an example of where, it seems kind of minor, but this took a while to get to this stage, right? So this is actually, we call this first of all, we call this the community science phase of our study rather than the citizen science phase of the study. And that is because we got some real pushback, especially among some of our, we're working very closely with a woman named Sandy Navarro, who's a promotora in LA, around the term citizen. And that might actually be a sticking point for some women. And so that is an example of kind of how we have to kind of change our language. We all know what citizen science means, but it was a point where that was not going to work when thinking and when interacting and communicating with community members. The other part of this that took a long time to get to was the idea is that that we were going to be collecting biomonitoring samples from the community members. Right off the bat, completely off the table was any blood sampling. That was just not going to happen. And one could argue like, oh, there might have been things that we could have looked at that were related to, breast cancer, early effect markers or something like that, completely off the table. And we have to kind of deal with that. You have to kind of account for that and flex around that. But another thing that we developed actually as a partnership is an app called the Taking Stock app. And this app was used and supported by the community members to actually log their product use, every single product they used over a week. And it was all stored in an app. So this, again, we tested it with the community members to make sure it was reasonable and supported it in every way that we could. So mostly just to kind of flag this as when designing studies, there may be the perfect scientific study design, but that you certainly have to kind of incorporate what folks may be concerned about and what are some of the community concerns in that design and flex around it. So we are analyzing the data right now from the community science page, which includes that the urine samples as well as the app data. But just real quick, I want to apologize for it kind of being over there. I meant to animate the slide. But what we found was actually it was over 1,600 unique products were logged by the 70 women. Around 20 products per women, but you could imagine there were some women who logged like 70 products. I think what's most surprising here, part of that too was also we were looking at what were women using, but also where did they buy it? Again, this is trying to get at like interventions, where are women sourcing their products. Target overwhelmingly was important. And then this to the right, this products with the greatest diversity of brands used. This really surprised me. I think if you were to ask me a year ago what women were using generally, like this is just a general statement, not necessarily this community, but generally that like it would all like, you know, body lotion would all narrow down to like three things that people are generally using. No, there's 51 different brands of hand or body lotion represented among the 48 users who logged that. So what that makes things real complicated when you start thinking about an intervention, but and kind of an interesting finding and something we're still trying to kind of tease apart as we move forward. So again, I just want to reiterate that this is really very much a collaborative project led by community voices as well as other researchers like Bhavna and Ami and myself. It's really a kind of a function of wanting to address kind of questions that we're observing and doing it in a way that not only answers it in kind of a rigorous scientific way, but also in a way that would meet the needs of the community. It is funded by the California Breast Cancer Research Program as well as the Passport Foundation, and you can check out our website as well. So I have one more Jamboard question. What do you think? How can scientists be good allies for communities? So I have some thoughts here, but I wonder if we should kind of move towards the Jamboard to look at those three different questions as part of the discussion. I'll just kind of real quick just share that some of my thoughts and love to hear if others have similar experiences or not. How can we be supportive is show up, be there, go to those community meetings, go to the local environmental conferences, things like that. Be available, be a resource to local media. That means like be willing to put your voice out there. Also elevate other voices within the community. Be very honest about what you know and what you don't know. And of course, involve communities through the entire study, all the way from the like proposal development. We've spent a lot of time when we developed the proposal for the study, having discussions about what makes sense. Are we addressing, your immediate needs? Are how would we design the studies that make sense in your community and so forth. So, and number one, also too, hey, community members and partners who support your studies, don't just kind of lean on or extract kind of the work of local community-based organizations without showing adequate support, financial support for those organizations to do what they do. And of course, listen. So I will stop sharing this so we can move to the Jamboard and maybe have kind of a more open discussion. I have to find my Jamboard. Hold on. Oh, great. Fun. Okay. So here I would, feel free to take yourself off mute. You can own up to any of your discussion points here. But let's see. So this is the first question. What are some barriers to conducting community-based research? Let's see. The time, certainly. Institutional support, right? So how is that valued within the institution? Does it fit your kind of more traditional markers of doing research? Oh, what does it mean when there's little, oh, it's because somebody's going to move it. Okay. Yes, so translating the research from science to lay speak Yeah, being flexible in how you talk about these things. COVID, overwhelmingly, yes, this has been huge in a lot of our work. It also means that we've had to really flex in terms of how we had this whole, like, we're going to do home visits and have these conversations and have these parties to collect the urine, and that just was totally off the table. And instead it was like Sandy going like to women's porches and grabbing urine samples and leaving, right? Like, it just totally changed our interaction with our participants. Trust from community members. Yeah, the academy starts with the research questions first. That's down over there in kind of institutional support too, right? Anybody want to call anything else here?
I put in one about, like, sometimes it's just tricky to figure out who the community is, right? Like, if you're doing a wide study, like, who is the community, like, who do you then interact with that's even, you know, not laughably representable?
Yeah, totally. And keeping in mind too that the community doesn't have to be geography based, right? Like, we have a project actually where we're doing some like social media outreach among Black women who are social media influencers, and that community is online, right? Like, that's a total. We can't like draw a line around those members necessarily. Yeah, this is really great. Just for the sake of time, I'm going to move to the second question. Let's see. What are some ways to support an equal partnership between researchers and community members? Yes, being nimble. Have regular meeting with community partners to engage community member in the decision making. Absolutely. Regular, predictable conversations. I also, you know, as part of that is like, it's also allowing for those conversations not just simply to be about the research, right? Like, to having times to reflect and celebrate like other successes that, say, your partners are having, right? So is there like a, you know, when Black Women for Wellness did a lot of work around putting pressure on Johnson & Johnson and baby powder, and when that was successful, we did a lot of celebrating around that. It's not directly related to the issues that we were working on at hand, but it's good to kind of support and celebrate those achievements along the way. Yes, listening, not talking at. Not being kind of extractive, right? It's getting them involved early, involving them in the actual question at the very beginning. Listen and be aware that community members are experience experts. Yeah, this is a big thing. This is hard, right? Like, you know, especially if you go through all this grad school and you're kind of told you're now an expert in something, it's hard not to say like, I'm the expert, listen to me, right? Like, that idea is that, like, you know, at the time I might be expert on the 3 dissertation papers I wrote, but I'm not an expert of what the community wants or needs or anything like that. And in fact, the importance of what you can learn and hear and kind of reframe sometimes, like, your thinking or a narrative around particular things by listening to community experts. This is great. All right, the last question I had asked, unless folks want to jump in, is how can scientists be good allies for communities? What is free, prior, and informed consent? Being curious. Yep. Yes, money is so important. Actually, the funding mechanism from the California Breast Cancer Research Program requires you to have a community PI and a research PI. And they require that means that the community partner gets at least 20% of the grant. And that's really important. I mean, it doesn't seem like a whole lot, actually. I mean, we exceeded that, but that idea of like having some kind of minimums of like of having, you know, ways that you are like, put your money where your mouth is, right? Like, if you're going to ask community members to kind of organize and gather their network to do research with you, that they be compensated. pay, listen, long-term, yep, showing up, help community members write grants. Actually, a sticking point of mine too is sometimes I find that a lot of the grant programs are way too onerous for community members. So scientists provide a key stakeholder role for community members, but often don't consider themselves in this way due to concerns around maintaining scientific objectivity. Absolutely. But we're also human too, right? Like we want to bring that element to this as well. So this is really great. I'm excited that you all use the Jamboard with me for my first time. And I think it's great to kind of have this out there and hear what your thoughts are. Are there any other points that people want to make about designing and conducting studies with community members?
So Robin, that was a really wonderful presentation. I'm going to ask a really prosaic question, but I mean, Silent Spring has a reputation and presence as a resource for communities based on its history and its current, its ongoing activities. But for people like how do you start? Like how, given the many questions that communities might have and the many ways in which people in more traditional research roles might be interested in the same questions and able to help each other, like how do people get paired? How do people find you? I may be wrong. I think Silent Spring is in a really unique position as an institution that straddles more traditional research and community-based research and has done it for so long that you're very well established. Whereas in more traditional academic environments where community-based participatory research has not always been very valued, it's harder to figure out how to connect and how to be useful to communities and what communities to target. I don't know. I don't mean to make it sound like it's top down, but like, how does the matchmaking happen?
Yeah, I think, that's a great question. It's hard. There should be like an app for that, like a Tinder for community members and researchers or something, right? Like,
yeah.
But I do think, first of all, there actually are some programs that try to match you. So CBCRP, California Breast Cancer Research Program, actually tries to have a matching program. But I think the other way to do that, though, is like not a lot of, my community partnerships are not born out of like the history of my community partners at Silent Spring are not historically partners at Silent Spring, meaning they're new.
Right.
But I think part of that too, it comes out of like, bumping, a group that we work with now, that I work with now is called Resilient Sisterhood Project. They're a Massachusetts-based program that's working on reproductive health issues, particularly among women of African descent. And the first time I met Lily was like accidentally. We kind of bumped into each other at a local environmental conference, and just kind of listening to her story. And she attended a talk I was giving, and then just had kind of a conversation over coffee. And it's really organic. But the key there is like showing up, like being in those spaces where you are accessible, and listening when folks want to chat.
Yeah, no, that makes sense. I don't want to imply that everything was, I just think Silent Spring has a reputation, which makes it more of an obvious resource for communities.
Yes.
And I'm not sure, I'm going to say this as a provocative statement. I'm not sure Harvard has that reputation as being a resource for communities, for those of us who are Harvard faculty. In fact, oftentimes it's a barrier, I think, because some communities, I think, see Harvard as a wealthy, entitled institution, and therefore anybody affiliated with it has that stain on them in terms of their credibility as a legitimate community service-related person. But whatever, Thank you.
Anna had her hand up.
Yeah, thank you very much, Robin. That's excellent. One phrase that I didn't hear that goes along with respecting the expertise of the community is utilizing their individual and corporate lived experience.
Yeah.
And I think that your studies really utilize that concept. And it's a phrase that has come up a lot in what I'm doing. So it's it's on the mind of lots of folks in the community these days.
Great, good point. Thank you. Diane, did you?
Yeah, I just wanted to share kind of a nice old story about how I got involved with the Mission Park community, Susan, which at the time we were wondering how local air pollution might influence cardiovascular physiologic outcomes in seniors. And I wanted to reach out and find a community partner to work with to ask some of these questions. And at the time, the School of Public Health community liaison was Bruce Smith. And Bruce just took me down the street to Mission Park and introduced me to Teresa Parks, who was a long-term community member and had a certain amount of trust in people from Harvard Medical School and some of the particularly some of the students from her experience in fighting Harvard when it was going to pull down neighborhood buildings and move the community out, and fighting and winning and getting this this whole community that some of you are familiar with, Mission Park, built, partly designed by the people in the neighborhood. So she was really interested in supporting doing some local air pollution research with seniors, and we met with the seniors, and the initiative took off with a lot of her advice and guidance. One thing she said to me was that the seniors really enjoyed the company, and she helped with establishing the trust. And they also like to have a good time, Robin, as you were mentioning celebrations and bringing positive events, be it music or food, in addition to the research, was a large part of our establishment of really what was a long-term relationship.
That sounds wonderful.
Yeah, good things happen.
Yeah, we've definitely learned that food and music bring people together. So that's great.
And we did do air pollution health effects research together, and we did find what were meaningful findings that contributed to the large body of scientific information for regulation.
That's great. Yeah, you can still do very good science while working in, the community spaces. So
great. I think we'll move on to part 2. I just want to be mindful of time so we can get to our 2 other speakers for today. Thank you, Robin. This was great.
sure. So now it's a slightly different slide deck and no more Jamboard, but so this is, when Tamara and I were talking about this session, we were talking about ways to talk about doing community work and, what some of our experience have been, and kind of thought of this in 2 different ways. The first is kind of like from the beginning, right? So like what's the genesis of a community-based project, like taking stock, but also the don't go away, stick around, and the idea of kind of carrying that relationship all the way through, and the really the kind of opportunities with sharing environmental health data with the participants and what that can do for many research projects. So now I'm going to pivot, and we're going to be talking a little bit about report back. What we mean by report back is sharing results with study participants. This hasn't been an area that Silent Spring has been working in for a very long time. It actually started way back when we were doing work on Cape Cod, when after we went in and collected a whole bunch of indoor air and dust and urine from our participants on the Cape, our community outreach coordinator was getting all these phone calls like, well, what did you find? Like, what happened to that air sample you took from my house? And so realizing at the time that, looking around, that it certainly was definitely not typical for studies to share those results back with community members. In fact, it was very much a top-down extractive kind of approach. And the idea that it might, that community members and there'd be benefits to the research as well as to actually share some of those results. So this is to say is that this is based on like 20 years of research that we have developed a lot of our methods related to report back. So I first want to talk a little bit about why report back is an equity issue. And that's because it's ethical, right? Like, it's respectful. It respects the autonomy of the study participants and increases the benefits for the research. And the idea there is that it is not seeing them simply as somebody you pay to grab a urine sample from, and that they have a role. And they really, honestly, it's kind of, they own that data, really. You are working together on the same data. It's also an opportunity for culturally competent communication. So what I mean by that is that it is a way, a lot of our report back reports are actually tailored for the community specifically, and to do that in a kind of a way that's kind of respectful and talking the right language in that way. Also, this idea of right to know, right to act, knowledge is power, sharing that. Also, we know from our experience that environmental justice organizations and other community groups, they like report back. It fits with this idea of community data, community ownership of the data. It supports beliefs around that research should lead somewhere. It should have an impact. It develops community capacity. It increases environmental literacy. It facilitates the production of community-driven tools, right? So it could be that they use it for a local campaign that they're working on. It could be that they are using it for some educational modules that they're developing, and so forth. So they, we've overwhelmingly seen that folks want it. So, over our 20 years or so of doing this work, we have developed various methods for doing report back that relies on multidisciplinary expertise. A lot of our, we're environmental health scientists, but, we also work closely with social scientists, anthropologists, and others, and do that kind of in a very multidisciplinary way. We've done many, many interviews with participants, researchers, IRBs about their experience with report back, done focus groups, advisory councils, stakeholder workshops. We do observational research at community meetings, user testing of reports at various levels, both even like within house as well as it moves out to the community. And now as we're moving in kind of a more digital space, we can use kind of digital analytics to help us think about and evaluate our report back methods. And have received funding all along through NIH, NSF, and so forth. So this is, from work that, this is from Julie Brody's paper, Is It Safe? And the idea here is that reporting results are more than a number. It's not like you're just dropping a table on somebody's lap, like a table with numbers on somebody's lap and walking away. You have to provide context to it. Right? It's not just, your blood level was 5. It is giving some, what does that mean in some way? So it's important that study result reporting often address, what did you find? How much? Is that high? And you can answer that relative to other people in the study, but also relative to, say, national biomonitoring data. Is it safe? Are there any health guidelines that could help you evaluate whether or not that level is safe or not? to address where it came from, what are some common sources of these chemicals, and then provide action. People typically want to pivot then directly to action, to taking the next steps. So we developed a tool about 5 years ago now called Derby, the Digital Exposure Report Back Interface. And this Derby report is a software framework that creates personalized reports. This is because, well, it is quite onerous to create personalized reports the old-fashioned way, which is what we did, which was like cutting and pasting into Word. And that is quite overwhelming. So what's nice here is that it's flexible, you can scale it, and also we have now created a back-end dashboard so researchers can kind of customize it for their own studies. When we share results with folks, people often show gratitude. People want their reports. I think there's kind of a misconception that people are like, oh, I don't want to know. You know, overwhelmingly, we always ask this question actually in our informed consent. Do you want your study results? And to date, out of the hundreds and hundreds of people that we've asked that question to, I think it's 98 or 99% of people have said yes, they want their results. In fact, of that crowdsourced biomonitoring program that I led, we had 725 participants. One said no out of that. People show increased trust with the research team when sharing the results. There's learning, there's increases in environmental health literacy when sharing results. There's a lot of brainstorming, thinking about exposures and exposure reduction, kind of, oh, you know, is this the product that I use? I mean, I have spoken to countless folks who've read a report and then the phone is brought into the bathroom and they go through their medicine cabinet with me to talk about the products that they use. Also, people have mentioned kind of reflection on family illnesses, especially if they're health impacted community members or participants. And then really kind of a pride that they're contributing to science or contributing to community health and research generally. We've also seen people use their results in important ways and effective ways, right? So over on the right there is showing some water quality results for PFAS and Hoosick Falls, but we've also seen this. So that's trying to, you know, demonstrate like these chemicals are in me or in my children, things like that. But people use the results also on a personal level. They make different choices. They might bring it to their physician. They might advocate for policy changes. So here is a look, and I'll give a link at the end so you can check out. We have a lot of example reports on our website, but here's generally a look of what our report backs look like. So people are given a secure access code. They can go in. There's always actually on that first kind of login page is always kind of a quick summary of the study. Okay, and then they enter in securely. And they see this first kind of what we call a summary page. This results summary includes headlines. So your sample had a higher level of a bisphenol than 95% of Americans. Notice there's a lot of these kind of, you know, we call them details on demands, right? Like you can click on what is a bisphenol? What is a sunscreen chemical? So they get these headlines that are personalized to them. Over on the right, we typically also include kind of overall study results, like why were you doing this study and what did you find? And then of course they can navigate to the various kind of their specific results and what they can do and just more information there. When they enter into the, say you were to click on one of these chemicals, you'd enter in, this is from a different study, but this is showing some individual results now. So this is, addressing that. What did you find and what is that, is it how much and how does it compare to others? And so how we typically do this is we have, we'll have the chemical. It's kind of plotted. We've gone through a lot of different graph designs. It's plotted in these dot plots. They're actually called CINA plots to show the density. And it shows your result in orange here shows the median in the US. So you can kind of see, and it also shows the median in the study. It's not live right now, but you would be able to hover over each of these points and it would show you the number. So if you were to hover over the orange point, it would pop up and give you the actual concentration amount. Again, what's really nice here is it allows people to interact with their graphs in different ways. And also, of course, these things are all clickable. So if they want to know like what the heck is microgram per cubic or per liter, they can click on that and learn more. But the idea here is to kind of get the gist, right? How you compare to others. So this is actually, I'm sharing this not to kind of dig into too many details here, but this is an analysis that that was just published, looking at kind of response to receiving personal results. So we've done a lot of interviewing and we hear about people's kind of stories about what they did with the results. But this is actually kind of a survey process that we did, looking at people who received their results, all of their results, including their personalized results. And then another group of people who received their results, but in stages. They first saw the aggregate overall study results, and then they saw their individual results. But, and that's pre and post, it's like before and after they received their personalized results. What I just kind of want to highlight here is, and this is in a study, the Child Health and Development study that had approximately half Black participants and half non-Black. That was just kind of the study design historically. But people reported generally that they are, so we asked them about their feelings after report back. And generally people had positive feelings, right? So overwhelmingly, the majority of folks talked about kind of very strong or moderate feelings towards being, does it increase curiosity? Or do they feel informed? Do they feel empowered to do something? There were some folks who did show, well, I should say, first of all, that the vast majority showed negative or did not show negative feelings, although there were some. And we actually saw a difference here between the Black and the non-Black participants and their experiences here, related to creeping up is that there were slightly more negative feelings among the Black participants than the non-Black participants. And the hypothesis there is that has a bit to do with kind of just the historic relationships with the medical establishment, and thinking about some results and thinking about blood samples and things like that. So we have been moving towards kind of our methods are always trying to refine, trying to be, raise up the kind of the most ethical standards, kind of the most effective ways to share these results. We've moved towards a digital report back in the last several years. It's been used by now dozens of studies. We've now moved towards a smartphone-based reports. This may seem maybe not like a wow, but this is actually really important for many individuals, for many communities. They access the internet on the smartphone. And so having a report that is designed specifically for smartphones is really important. This is actually some work from the ECHO cohorts on study results. We've also done the smartphone reports in Puerto Rico and the PROTECT project. Again, similar idea, you get overall study results, you get your own, you can click on things, you can learn more and interact at various levels. Another thing that we are working on and improving constantly is the what we call researcher derby. It's the back end of derby. It means that our goal is to put it out there so that anybody could say, I want to do report back, I'm going to like customize my study, right? So you can do things like, you upload your data. We tell you how to upload your data. You generate your headlines. You then create content. How do you want to talk about these chemicals? And it's a step-by-step guide, and then allows you to kind of set your own rules for not only content, but how those headlines work, and provide the content or the kind of the framing that's best for your study. So I encourage you to check out our website. I put the hyperlink here at the bottom, mostly so you can check out all the examples where we've been doing this work and where we continue to do this work. We've done it for report back. It started as indoor air and dust and urine, but a lot of our work has been focused on biomonitoring levels, although we've done it for dust, we've done it for water. We recently did it for whether or not you have flame retardants in your couch on a testing program, and we're currently developing methods for sharing results related to, as I said, in taking stock, right, is that women were scanning their products. So we want to give feedback on the products that they scanned. Trying to think about the most effective way of sharing that kind of information. So I encourage you to check it out on our website.
All right, thank you, Rob. I'm going to do, can I talk and do a clapping emoji at the same time? Yay. So I just want to say thank you. I think that was really useful. And I think, if you're game to stay, we might have some more chat, comments from the chat. But I think that we can move on. But I think, I think this is a really, both thanks for both practical and sort of big picture thoughts, because I think we often talk big picture and then don't ever get to sort of a solution. So I think that was helpful to have both.
Great.
I'm trying to manage my number of web tabs right now, but I think it's gonna be fun. So yeah, so I think that's great. We're going to kind of shift a little bit, but not too far. I think, again, in kind of a, thinking about ways to share, results, ideas, science with, the broader community. I want to introduce Lisa Frueh. They are working in the Geographic and Contextual Measures Core of the NIEHS Center, but definitely have we've been working on this environmental racism project for a while, and it was not moving at a very rapid rate of speed. So they came in and got kicked us all in the butt in a lovely way and got it moving. So I there was lots of very thoughtful scientific input and people helping with lots of different pieces. But if Lisa had not been working on this, I think we still would be probably a year out from having anything that looked half as good. So I just want to publicly acknowledge that that was you herded the cats in a magnificent way. so you can take it away. And also, prospective doctoral students. So, students want to, chat how wonderful it is to be in the program. Go to town.
Well, thank you for that introduction. And yes, any current doc students in the department, feel free to send me an email. So yeah, I'll go ahead and share my screen. Let's see, this should work. Okay, so for those of you, some of you might have already seen this sort of online interactive web resource about environmental racism in Greater Boston. So I'm not gonna scroll through the whole thing, but what I'm gonna do is tell a little bit of the story. If you haven't seen it, I'll provide a link at the end and you can sort of thoroughly scroll through it on your own. But I think just in the interest of time, I'm gonna talk more broadly about making this sort of online resource that was sort of for a broad audience, which is something that I have never really worked on before. So this was sort of Gary's idea, and Gary and Jamie, there was this idea of how can we connect the Geographic and Contextual Methods Core, geospatial, I don't know, I can always say it wrong, and the Community Engagement Core. So we thought, can we make sort of a GIS-based resource about environmental racism? And we knew we wanted it to be Boston focused because we just thought it would be more interesting to our communities. And Tamara's big input at the beginning was we also wanted to include solutions with resources for readers and ways that they can get involved in their communities. And we sort of settled on ArcGIS online story maps, which is a really easy tool to use. Harvard pays for this enterprise service. So if you've never played with it, I encourage you to. It's way easier than ArcGIS desktop, and you can make beautiful interactive maps and stuff that I will show. So we settled on 4 focus areas. The first, racial residential segregation. So that's sort of this historical backbone that drew heavily on this book by Richard Rothstein, The Color of Law. If you don't have it, you should get it. It's interesting and informative. Part 2 was environmental racism at the neighborhood level. This is sort of the story that I think a lot of people are familiar with environmental racism, which is there's, a chemical plant in my neighborhood. And then the parts 3 and 4 were really informed by Gary's work and Tamara's work. So we have environmental racism at the household level, talking about indoor exposures, and then environmental racism in personal care products, which Tamara works on, and obviously Robin Dodson also works on too. So I'm not going to like go through all of these pages, but what I am going to do is pull up the parts that I found most cool or like the parts that might highlight the utility of this particular tool for communicating to a broad audience about maybe complex histories. So in this case, in part 1, we talked about segregation and organized it kind of chronologically from redlining and restrictive covenants through the mid-century suburbanization, urban renewal, and then into contemporary times. And then I think that the most challenging part of this page for me was how to convey the relationship between historical factors and contemporary demographics. And I think this is really where the ArcGIS Online shines. So this map shows, if folks are not familiar with the story of redlining, very briefly, in like the 1930s, the Homeowners Loan Corporation created these maps of major US cities where they delineated which neighborhoods were going to be prioritized for federally backed home loans. And it is perhaps unsurprising that based on racist and classist grounds, Black neighborhoods, immigrant neighborhoods, and poor neighborhoods were basically designated as not lendable and basically disinvested from. So we see in Boston, the red and yellow parts are areas where the Homeowners Loan Corporation said, we're not going to lend there, whereas green and blue, they did. So we see, unsurprising that like Newton, richer suburbs out in the out in the hills are green and blue, and then the inner city is red and yellow. So anyway, in this map, people are able to click on a contemporary demographic, like let's click on Black population. And in this map, the size of the dot corresponds to the percentage of Black population in a census tract according to the 2014 to 18 ACS demographics. And the color corresponds to the whole grade back from the 1930s. So what we see is this overrepresentation of Black population in formerly so-called redlined areas, and an underrepresentation of Black people in blue and green, so considered safe for lending areas. A similar pattern is seen with poverty, and then concentrated privilege. We see the opposite pattern. We see where some areas have gentrified, like Cambridge, and we also see that the suburbs now are where we see concentrated racial and economic privilege being overrepresented. So that was just, I think, a good example of the strength of this particular tool. Part 2, we looked at environmental racism at the neighborhood level, sort of structured it by air, water, and soil pollution and green space and urban heat. And I just wanted to highlight the green space and urban heat section as this data dashboard functionality, which it's also very cool and interactive, and I think can show some really complex things very clearly. So I'm gonna like zoom into all these maps. We have the redlining map here on the left that can you see my cursor? Yes, okay. Redlining map here on the left, and then we have tree cover in Boston, and then land surface temperature. So we see that there are more trees in areas that were considered favorable for lending, and there tend to be hotter temperatures where there are fewer trees, which makes sense. And what's cool is that you can link up the data in these maps into graphs that are then interactive. So we see that comparing Hulk grade to tree cover and temperature difference from the city average, we see that green and blue tend to be, or A and B grade, tend to be have more tree coverage and be cooler than the citywide average, and the opposite is true for C and D grades. And if a user wanted to click on one of these bars, it would show them which areas in the map are represented by the A grade, and B and C and D. So we see that C and D are concentrated in the city center, and A and B are concentrated in the outskirts. So anyway, yeah, I just think that that is a really neat way to explain. I mean, there's like 3 different things going on and 3 different types of comparisons going on in this graph. And I think that this does a good job of engaging people. I'm not going to show anything from this page, the household level. We talked about indoor pollution, secondhand smoke, lead, pest problems, and mold and moisture. This was sort of maybe the biggest challenge to make this part interactive, because there's not a lot of spatial data on household exposures, sort of even at the aggregate level. So I did look at, I have some maps from like childhood blood levels, because that's publicly available. And there can be some interesting comparisons made with environmental justice communities and high blood levels. But this page was much more about letting readers know about what they might need to be worried about and pointing them towards resources and solutions for minimizing those exposures. The last part about personal care products, we started out talking about racial and ethnic differences in personal care product use. This is where we talked a lot about the Taking Stock study, and explain sort of what some of these toxic chemicals do. And then we sort of broke up the rest of the page to talk about determinants of product use. So it's obviously not just an individual behavior. You might be, what products you use might depend on, Robin touched on this, but what's available in your neighborhood. If you work in a beauty salon, then you're probably going to be much more exposed. And also cultural determinants, which Robin touched on, which is like Eurocentric beauty standards might cause people to want to bleach their skin or straighten their hair. So I use a data dashboard on this page too, to show the Restyle study, which is Tamara's study, and Marissa Chan, who's a doctoral student in the department, is working on this, looking at different neighborhoods in Boston and which hair products are available there and how likely those hair products are to be high hazard according to the environmental working group. And so what I like about this data dashboard, and the reason why I want to show this, is we can show pretty complex relationships. In this case, we have rinse off versus leave-in products. And then I'm able to also plot, and this is all like so easy to do in ArcGIS Online, I have to stress. I can also plot sort of percent Black population like of each neighborhood over this plot. So we can see that as the percent Black population increases, the ratio between leave-in products and rinse-off products is almost 50-50 compared to in the whitest neighborhood, Beacon Hill, where there are much more rinse-off products than leave-in products. So pretty complex things to communicate, but it really only takes a couple clicks to make it happen. This is also interactive in that I can click on Mattapan and it will highlight where Mattapan is. I can scroll through the different risk ratios here. And what's even cooler about this is that right now, this was just a pilot study. There's like 7 neighborhoods, but it's expanding. Marissa's working very hard on this. And I can very easily update this. I can just go into the data table and just append all of the new data with one click, and it will update this, and it will just be done in like 5 seconds. So that, I think, is what is really strong about this particular functionality as well. Let me just remind me later. Okay. So the other cool thing about this is that you can do integrated Google Analytics. So we had, since launch, 739 total users from all around the world, mostly in the US, mostly on the East Coast. Most of those were direct traffic, which means there was a link that led someone to the website. They didn't find it through, Google search. Most people viewed on desktop, and the average engagement time was 2 minutes and 7 seconds, which is not a really long time, but it's not a very short time. So I'm going to say it's a win. And so I think the utility of this particular product is interactive. engaging visuals. If you do get a chance to scroll through, you'll see there's also pictures, and I was able to pull stuff from various archives and sort of, I really tried to make these stories like interesting and not just reporting findings. It's really easy to use, can't stress that enough. You can also embed other websites and ArcGIS online products really easily. And then the final thing that I will just touch on is thinking about, is this a useful tool for improving environmental health literacy? So we are sort of thinking that there might be a potential publication in that if people use this website, do they feel like they've gained more environmental health literacy? We included an optional survey in both English. Oh, I should say the personal care products page was also translated into Spanish. So we included a survey both in English and Spanish that people could take that talked about their experiences on the website, on any of the parts or the website as a whole. And of the over 700 users, only 2 people have taken the survey. So we might have to rethink our recruitment strategy if we really want to get a paper out of this. But Katie Tumshoe and I worked to make this survey, and I think it's a good one, and it's a really important question to ask. And so I think that's a possible future direction, or an actual future direction that we're going to go into. Obviously, we're going to continue updating the Restyle data, and then I'm also starting to do a similar project with the Superfund Center about drinking water contamination. So something where you could put in your zip code and it would pull up, what are the unregulated and regulated contaminants and which ones are higher than where you want them to be. And you could then click on that and it would give you more information. So that, keep an eye out for that in the next year. End of summer, I think, is the goal, but how it goes. Okay, big thanks to Tamara James Todd and Gary Adamkowitz, who were the sort of faculty leads on this project. Marissa Chan, Jared Liddy are doctoral students in the department who played a big role in this. Eileen Chow helped with all of the distribution, which was all new to me. So very grateful for her communications expertise. Esther Diabene helped with some time series maps, Katie Tumshoe with the environmental health literacy, Felicia Heykoop with general expertise and advice, and Azariah Boyd helped with translation. And also Jamie hired me, so I should say thank you to Jamie too. But yeah,
that was the easiest decision I've made in a long time.
I don't know what time it is. Let me see. Do I have time for a couple?
Yes, we absolutely have time for
6
questions.
minutes if anyone has questions.
Yep.
Absolutely, great. Any questions, please feel free to unmute yourselves.
And I think one thing we can offer as a center is if people are if anyone's interested in doing one of these, it turns out there's options through the Center for Geographic Analysis to take a short course in how to make a story map. But I think, as Lisa has demonstrated, they look really fancy. I just walked a high school class through, they're making them as their projects for their GIS course. So, I wouldn't be afraid. The first one I did at the Center for Geographic Analysis was about camel habitats. And, I made a slick looking website all about camel habitats, knowing nothing about camel habitats.
I'll also just make a note of saying that, this is a nice transition from thinking about the individual level. So what we've done, how do you work with community-based organizations to do research? Then how do you report back at the individual level? This is an opportunity where we're saying, look, the science that we're all doing, a lot of that science is being funded, by, federal taxpayer money. How do we start thinking about how to report this back at the community level? So Story Map is one of these tools that we can use to actually be able to do that. Sorry, Mark, I didn't mean to interrupt you.
No, not at all. And I didn't have a question. I just wanted to thank Lisa for this. I mean, it's terrific. This is really amazing work, and it's great to have that up there on our site. And yeah, I think more use of this kind of stuff to communicate what we're doing and other issues maybe that we're not specifically working on, but that are important issues to communicate to different populations it would be amazing. Would be great to do.
And we got tweeted by Esri Story Maps. So, I mean, that feels like,
Oh,
and
did
Bob
we?
Ballard. Yeah, Esri
Yeah.
Story Maps and Bob Ballard, it feels like a win.
So Lisa, this is phenomenal.
Yeah.
Can I just ask one more question? So like, it sounds so a lot of the hits that you've been getting are people who've had access to the link and looked at it directly. Have you thought about how to make this tool or this work, how to get a different audience to link into it? Or maybe that's the whole purpose of it being available on a internet-based platform, is that it is available to the whole world. But for example, like maybe policymakers should be looking at this, or maybe high school teachers should be looking at this, or there's maybe different stakeholders and different interest groups that might not necessarily think about accessing this or seeing it, who would benefit from it. And how, I'm very old-fashioned, so I don't know, just having something on the internet is fantastic, but I feel like there's another piece to disseminating it that might be useful. And I don't know if that's something you've thought about, or if that's not possible, or what your take on that is.
Yes, that's definitely something that we've thought about. So one of the things that we are planning on doing is sort of distributing via QR codes. There's some upcoming community engagement events that I think maybe Felicia can speak to at the zoo. Nod for yes. Okay, zoo. So it could be something where we have, a poster with a QR code that's like, find out about da da da, and people can click it and take the link home that way. But yeah, we have talked about effective distribution. I guess right now it is just on the internet. I can tell you my 15-year-old German cousin said she sent it to a couple friends. So that's still like 3 hits in Europe. But yeah, distribution is definitely a challenge. I mean, I think the problem is who ends up on the Harvard Chan-NIEHS Center website / community resources. It's other academics. So yeah, but it's definitely been something that we've been thinking about. And I have sort of a list of people that I was in contact with through the development of the project who I will ping to help distribute. And we had some help from the Environmental Defense Fund too with distribution, which is in their newsletter. So that, yeah, we've been trying, but it's definitely a concern.
Good. Thank you.
Lisa, if I could just say something. Well, as I've said many times before, amazing work. The more I think about it, I think about other ways that we could get this story out to other people who might be interested in it. I know Anne is on the call as well. I think about the other CECs for the other NIEHS centers. Frequently, just like you brought in the data that Tamara and Marissa have generated, I think people will look at this and think about ways of taking local data that researchers have collected and finding a new way to present it. So for people who aren't reading the papers, how do you get just local data back out to the public in an interesting way? So whether or not people are doing an environmental racism story or not, I think you've done a fantastic job of just highlighting local data. It's something we're not trained to do, but you did an amazing job with it.
And I cannot stress enough how easy it is. Really, I encourage everyone to go click around on RTS Online. I think GIS can be so intimidating when you're using desktop, and I just think it's a really powerful tool. And like sometimes, you can just put like a data table in there that might have spatial associations, and then you can put it onto a map that already exists. All the ACS data are already in there in a living atlas. It's just, yeah. And I'm always happy to talk about it. I'm very excited about this. So cool. I think that puts me at time. So thank you all for listening.
And Anne, do you want to talk about how we're going to try and do one with FracMap? I know you can say something else, but
No, I was going to say that it will be very easy for us to have a webinar with our CEC national group. That would be something that would be very easy. They're always looking for things to do. And then, yes, the FracMap, which is not a story map, is coming along nicely. And so we will have, the FracMap is a geocoded bibliography of the of water quality, health impacts, water usage, et cetera, associated with fracking sites in the US. And so that's another use of the ArcGIS, but it's not this particular aspect of the ESRI product line.
Yeah, I'm also
Sounds really interesting. Yeah.
given Elsie's project 3 in Superfund and the mapping of water metals, that could be a place where something like this could be good.
So that's
We're
that's
working
what we-
together now.
Okay. And I was gonna say, I don't know if this is what you referred to, Anne. I mean, when you said the CEC group, do you mean the centers, core centers CEC group?
Yes, yeah.
Yeah, right. Yeah, I mean, in general, sort of presenting, finding a way to present this to the other centers would be great, both as what you've done, but also as, an approach. So trying to get across that message, Lisa, you're saying that this is actually relatively easy if you, not to be daunted by it. But I can certainly look into whether there might be a venue or opportunity to do that if you were interested.
Well, I mean, there's the CEC meets every month. We can do that, but also we could run a separate webinar that Lisa could run on teaching how to do this. And we certainly have a huge number of stakeholders, I think, that would be interested in that.
I would be happy to do something like that.
Great.
It's a very cool tool. GCMC and CEC for the win.
Working
Yeah, so
together.
I think folks, so if there's anything you can think of that, this would be a useful tool, we're happy to support people in, kind of taking baby steps to do this, because it really, like, it's something that, probably in under an hour you could have, the New York Times is not going to feature it in their COVID stories, because that's where we started to see a lot of the story maps. I don't know if everybody during COVID noticed the New York Times has an entire story mapping group. But in about an hour, this is definitely much more than an hour's work, but you could get something that is web showable, in a reasonably small amount of time. So it's not something that has to become a 6-month endeavor, unless you're going to go crazy and make a 6-module beautiful translated into different languages version.
What Lisa did is,
Yeah, exactly.
yeah, that's a high bar.
This is aspirational.
Yeah, this is a high bar.
Well, thank you so much, Lisa. This was terrific. And just again, we're all like in awe of this work. So we really appreciate all the hard work you poured into this. So I just, to round this out, I want to make sure, so we've gone from kind of the how to do studies working with communities to the individual reporting back and recognizing community members are not just our study subjects, but to really also then kind of being able to report some of this back to communities in an accessible way. And then kind of finally, how can you be involved in this type of work here at Harvard? And so to provide an example of that, Felicia Heykoop, who is the research assistant for our community engagement core here with our MEMCARE Superfund Research Center, is going to present some work. They earned their MPH in law and policy from Boston University School of Public Health and hold 2 bachelor's degrees in applied anthropology and film production. And so that it's been really fun to work with Felicia, because these were very different areas than anyone else on our team. But really, again, like leveraging that expertise and background in documentary filmmaking to really help tell public health stories. So Felicia, feel free to take it away.
Thank you so much. And thank you for allowing me to present today. So I'm going to get myself set up here. All right. So as Tamara said, my name is Felicia. I am the research assistant for the Community Engagement Core at the urban site for this MEMCARE-SRC. And I'm going to share what we've been up to in the past year when it comes to the various ways that we strive to reach the community in Boston beyond just research aims. So in October, we were allowed to have a community booth at the Rozzi Farmers Market. I was joined by my colleague Azariah, who is also a research assistant in the CEC. And our booth invited people to talk with us about ingredients and personal care products. This was an opportunity to talk with guests about the products they use, but also demonstrate 2 phone apps that help consumers make informed decisions about their purchases, including Silent Spring's Detox Me app and the Environmental Defense Fund's Skin Deep database app. And the guests could walk away with fact sheets that included instructions for downloading these apps, so they had actionable next steps. The market manager loved our booth, and he invited us to come back for a community event, which takes place in the lawn area of the market, allows us more space, and gives us the opportunity to do like a live demonstration, like say a DIY of safer product alternatives. And responses from the guests varied. In general, most people approaching us were already had some baseline knowledge of toxic chemicals, but then we could engage with them on a deeper level, sharing the research from the labs of Dr. James Todd and others to show instances of greater toxic exposures in products marketed to Black women. Then Halloween weekend, we had a 2-day booth at the Franklin Park Zoo for their annual Zoo Howl event, where exhibitors are encouraged to give away treats and provide information on environmental stewardship. Thanks to Project One's Mark and Kaylee, we were set up with their XRF and able to demonstrate how scientists measure metals in soil. Our booth featured 8 soil samples, including Dorchester, the Arboretum, and Cambridge. And we engaged with lots of concerned residents, including people who eagerly shared their experiences with us. We polled attendees about their concerns about environmental exposure specifically, and most respondents, including young children, responded with concerns about water safety. This is exciting because, yes, of course, we're using this booth as an opportunity to kind of gauge interest in the community science efforts, which we're going to launch this summer. But of course, responses from our polls tell us that in general, the community could be very interested in our water filtration intervention as well. And I want to extend my gratitude to the students and staff who helped make this booth a reality. Marley Quinn, Marissa Chan, Amanda Hernandez, Mona Dai, and Zifan Wan. And of course, Dr. James Todd and her whole family who helped us set up. And my sweet neighbors, David and Melissa, who let me take all of the sunflowers out of their lawn to decorate our booth with. Attendees were shocked by the sample that is from my backyard, as it contained exponentially higher levels of lead than any other sample on the table. I live in Eggleston Square, which is where Jamaica Plain meets Roxbury, which is formerly Redline Boston. And then we can engage with attendees about remediation options based on that expressed concern. And another thing that's, some remediation options we talked to them about were the planting of sunflowers, which love to eat lead, hence the decorations of our booth. We also connected with the neighboring exhibits, which is the double blessing of having these kind of ground level events where we get to meet our greater community and also community-based, community-serving nonprofits who share our goals of bringing awareness to the legacies of redlining in Boston, health inequities, and the impacts of the environment on our health. Oh, went too far. Social media is another place where we seek to engage the community as a broader audience. We have resources available that are general health educational materials. Each tile that you see here is the title page for what Instagram calls a carousel. And like a slide projector carousel, it holds a limited number of slides in it that a viewer can tap through to tell a multi-part story. In some ways, this can also be an iterative process. The nutrition posts that you see in the left corner were inspired by a presentation from a student at Harvard Medical School, Noel Castilla-Ojo, who polled employees in 5 community health centers in Boston about what resources were available to patients for improving environmental health awareness. She said something that came up often was that patients asked about what foods they could and could not eat while pregnant, but that providers did not have educational materials on how preparing food also exposes people to toxic metals and chemicals. So in response to that, I made this 2-part series explaining exposures beyond the very classic pregnancy nutrition advice of like, don't eat big fish. This included talking about PFAS from nonstick cookware and phthalates from fast food, which, as you may know, absorb microplastics in every step of their production process. We are also working on 2 podcasts. We will do one about this SRC and metals exposures as told through the legacy of the St. Louis baby tea study. But we have one that is coming this year about toxic ingredient exposures that is about halfway through production right now, and recently finished this rough cut of this interview with Dr. Dede Tete, pictured here. She's a professor and scientist with a dual appointment at Chapman University and the City of Hope Cancer Center. And I just had to share this clip from her about community-based participatory research, or CBPR, because it's a perfect definition of CBPR. Oh, constantly. And it also clearly demonstrates a way that podcasting can work as research translation purposes.
The ideas from the community jump-started a completely different but similar focus to what I was a part of 7 years ago when I moved out to California. So we, now we have coined kind of like what I'm doing now as a part of this process, the Bench to Community Initiative, where I'm partnering with a bench scientist. Her name is Dr. Lindsay Trevino. She is like my brown sister from another mother and a different father. And I just love her. She is an assistant professor at City of Hope Comprehensive Cancer Center, doing amazing, amazing work. And we are partnering together to really continue to answer the question of the community as it relates to, are the hair products that I'm using increasing my risk for breast cancer? So my role with this particular project is really exploring the social context of product selection and usage, and all of those social, cultural contexts that such as discrimination, racism, how does, fatalism, how does all of the things that are occurring in life, how does that determine your product selection and usage, and really learning some unique things about behavior patterns, right? And then at the same time, what Lindsay is doing in the laboratory is we're actually taking different types of parabens, which are preservatives found in personal care products, and we're testing them on breast cancer cell lines in a laboratory. And the whole point of us collecting this data, again, is because the community is like, okay, what are these chemicals actually doing from a biological perspective? And then secondly, I have this strong connection of my identity to my hair, which determines how the world sees me.
So here are some of my aims for the future when it comes to community engagement and using media and events. We're going to release that Beauty and Justice podcast. It's going to happen. Production is really ramping up, and we had the pleasure of working with even more students on this. Marissa Chan is my co-producer. We also received editorial assistance from Okania Chowdhury Paulino and Katie Van Wert, who is our Northeastern co-op student. And we have 2 creative post-production assistants, Kate Hardock and Lisa Johnson. I'm very excited to work with students. Is one of the highlights of my job. I also want to increase postings on Instagram that are built from community feedback, just like the nutrition ones, because I believe that it should be a majority iterative process, not just throwing information out into the ether. I definitely am already working on this with my colleagues, but construct a bi-directional partnership with for the community science effort this summer. We want to make sure that we are serving them, not just that they're serving us. And we want to make sure that there is like a feedback process built into it, and we're working hard to establish that now. And we're also going to be reprising the events at the zoo and at the Roslindale Farmers Market, starting with the zoo's Earth Day celebration. So what I would want to use the remaining time for is 2 things. If you have any questions, of course, I'm happy to answer. And then also, if you listened and saw this and you have some comments or have some inspiration to share with me and the team, I'm open to suggestions, or, hey, I have a student that would love to work with you, please tell me. that is also how to contact me, and our handle on Instagram.
Wonderful. Thank you so much, Felicia. And so I'd like to open up for questions for Felicia first, but then also I'd like to take a moment after that to open up questions to the whole group. So if anyone has any questions for Felicia, this again, these are some of the examples of what is ongoing in the community engagement core for one of our centers. There are multiple centers here in our department. So, but definitely any questions, feel free to ask.
So I have one. This is Mark. Felicia,
Hi,
thank
Mark.
you. That's great. Hi, how are you?
Hi,
Looking forward
good.
to all those podcasts coming out.
Thanks.
And forgive me if I missed this and you said it, but I'm also wondering, as part of the podcast lineup, like what you have thoughts about? So I think you mentioned something about sort of feedback. So redoing something after getting feedback from community members. What about actually podcasts with some of the community members and their take on some of these issues, whether it's our partners or actually like people at the zoo where they come up to you or something like that? Are you thinking along those lines at all?
Yeah, definitely. Marissa Chan is the producer who handles talent wrangling. So as far as getting, I'm the technical producer, as far as like getting community members, that's something she's actively working with Lily Marcelin of Resilient Sisterhood Project to do. We definitely want to make sure that we handle that in a sensitive way. And I think Marissa is going to nail it. And as far as like man on the street stuff, we are definitely interested in that. We actually we're throwing that around in a brainstorming session to collect impressions both on personal care product use and also on environmental exposures. It's something that hopefully we can be set up to do in a future event, because we meant to do it at the Zoo Howell one, but we were originally set inside in the tropical enclosure and it was like not conducive to getting good audio. And I was just like, all right, we're going to shelve that idea and come back to it when we have an event that's not quite so echoey.
Great. All right. So definitely I'd like to, feel free to, ask away to anyone. Robin, thank you so much for sticking around. And, if there's questions also for Lisa or Felicia, that'd be great. I saw a question in the chat for Robin, but maybe that one was answered perhaps. Or also just thoughts around, how can we do this work better in the context of working with our immediate community or, greater community at large.
I just have a quick comment for Robin, which is the report back tool is so cool. That is such a great idea. And it's like amazing that that's going to be scalable for other people to use too. It's just a great idea. It's not something I would have ever thought of, but obviously it's just like such an obvious solution. So thanks for sharing that.
Yeah, no, and I just want to stress too, we're always looking for collaborators on that. The idea is to get it out there. We actually have a contract now working with ATSDR, so they would use it in their community health studies too. So it's really exciting, and we're always looking for researchers. Tamara is gonna kind of join that effort with the new R21 that we got. So yeah, we're looking for people to play along with us.
And I know many on this Zoom know Kaylee, our RA for our St. Louis Baby Tooth study. She's actually away, so that's why she would be here. There's no question, but she is, and I don't think there's any other word than dogged about getting me to make sure we do report back and working with you, Robin, on this. So I think we're trying to make something happen there. So I'm excited.
Wonderful.
I have sort of a generic question for everyone, because I feel like there are a couple of themes that I think are incredibly exciting from all the presentations around how do how do we do research that's actionable? And one of the pieces of that is making sure that we're addressing questions that matter to people. And then do we address those questions in a way that provides data that can actually be used to implement policy and interventions that can make people's lives better? And how do we sort of provide literacy or infrastructure to empower communities to help make that happen? So everything that everybody's doing, I feel like, plays to those goals in a beautifully elegant way. But the one piece of this process that I am really depressed about is the discrepancy, scientific credibility. In other words, there's so much information that people can access, much of which is garbage. And so how do, I mean, aside from sort of having a credible pedigree, if you're at Silent Spring or you're at Harvard Chan-NIEHS School, how do we work with groups, work with research translations in ways that helps people discriminate between information that's useful and information that's not true? And I sort of, you know, I one of my hats is as a clinician, and I have patients who get laboratories testing done at alternative medical laboratories that are very disreputable, but they look exactly like reputable labs. And I spend a lot of time trying to explain why this data is more useful than this data. And that's actually really hard, a hard thing to do for anyone. And when there's a lot of information available online and in other venues where it's much harder to vet, how do you think about not enforcing, but communicating credibility and helping develop sort of a critical approach to information? And maybe that's too vague, but.
I think that's a really good question. I think that part of developing media literacy is also like that these experts, meaning like scholars who want to communicate their results, like have to learn how to do it in a way that's exciting. So I think it's like, we think about like, okay, I'm just thinking about like anti-smoking ads or something. It's like smoking ads are like smoking sexy, and anti-smoking ads are like, this is the % chance you'll get lung cancer. And it's like, what are you going to be attracted to? You're going to be attracted to the colorful ad with the beautiful person, you know? And so I think in some ways, like trying to do stuff that's more engaging, podcasts, things that people like listen to, or like to engage with in a way that sort of plays to this sort of, people seek out information, obviously. And yeah. I think that if all the sort of so-called correct information is couched in like language that's completely inaccessible, people are never going to come across it. So I think one way is to make things more accessible. And then the other way of how to make people more media literate about figuring out what's credible, I don't really know an answer to that.
Yeah.
I guess maybe that should be on our public schools, but we'll never really see that from them. So,
yeah. But I think that's part of the task, is really to help part of literacy, whether it's environmental literacy or other forms of literacy, is understanding how to vet different information sources in a way that's useful, whether you're a community member or a policymaker, and figuring out what role, if any, we could play in that process, I think is really challenging. Felicia, you want to say something?
Yeah, Robin brought up something in her presentation about how most people get product recommendations from people they know. A lot of the information around products is from people they know. And I think that what we can do as scientists is partner with reputable community members. And I bring up Lily Marcelin at Resilient Sisterhood Project again, because like if you've met her, like you know the charisma and the big sister energy that comes from this woman who's absolute force in her community. So, you know, maybe I can't help people discern, you know, the misinformation from good information, but I can have a reputable community member like distributing our information and backing us up and connecting us to her community and her constituency.
Felicia, I think you're right on point. I think like this idea of kind of the trusted voice and thinking about who those trusted voices are. I mean, they're different. They're totally different in different spheres. but using that in an effective way. We actually have a project with Lily where we're using like these social media influencers, because we know that people are paying attention to influencers, that we overwhelmingly have seen in our work, and using, so why not actually like correct the narrative, I guess, that's coming out of some of those influencer spaces. So I think you're right, like using the voice that people are listening to is really, really important.
I just want to say that how impressed I am with this stuff, and in some ways I just think it's so much of a shame that it's not really out there. So I wonder if you know, developing relationships with either the press, like the Boston.com. I mean, I could see where Boston.com or Chronicle or something, particularly Lisa, your project, I mean, they could just really highlight this, and then it would get a lot of influence, and or you know, getting this information to particular politicians who tweet a lot, like Ayanna Pressley or someone like that, who I think would be extremely interested, and just one retweet from her could, you know, blow this thing up. And so, you know, in some ways, I think, you know, we might be thinking too small. I mean, it's good to be in the community, but I think this is just such compelling stuff that a lot of people, lay people, would be interested in it.
I'm sorry, Lisa, you can go ahead.
I think I was going to say the same thing that you're going to say, so you say.
All right, or Gary might say. So Glenn, I think that it's so spot on and very powerful. And in fact, Lisa, correct me because I don't remember when, but at some point very soon we do have an interview with the Boston Globe on this issue. So it is making headway. But I love the idea of like nurturing relationships with the press, with politicians and policymakers. Like that's critically important, and it's not something that we always readily do, if ever do. So yeah, I think that's a great point.
Yeah, and I think, you know, being on some webinars with like, you know, Markey and stuff, you know, he's always talking about how his staffers are desperately trying to find reliable sources of information. And so, you know, I think sort of to Susan's point that we're weirdly harder to find than we should be for the people who are looking for us. And so how do we, you know, but I think again, like part of it is, you know, dry research articles are not what folks are looking to find. And so I think, you know, the real coolness of some of this, you know, sort of newer methods, I think, is that we're in the space, right? So, you know, we weren't even in the conversation or findable before. And now at least, you know, with all these different ways, there are ways people can find us if they're looking.
Yeah.
Which seems like it seems like a stupid first, like it seems like such a stupid thought, but it's such an important first step.
Yeah. I mean, I think there's always a tension, at least historically for academics, between being so-called objective scientists and being advocates, right? And oftentimes those two roles there's a firewall between them. This isn't exactly advocacy, but it borders on that. And so I think we're not as experienced with disseminating messaging in a way that is more in keeping with the advocacy part of science. And I think that needs to change, and that there are too many important community issues that have gone unaddressed, and that science needs to be more embedded in work that does overlap with advocacy. But I don't know if that's not very popular here, but I think.
Yeah, although I would suggest maybe you think about how you do not have to be the advocate. You can find the advocates and support the advocates and let them be the voice, the outward voice.
Ayanna Pressley can be our advocate.
Yeah.
Yeah, I mean, I did the environmental justice training with Tamara and at Columbia, or virtually, but at Columbia last summer. And like one of the messages that I took home from that was that one person cannot do the whole pipeline from community engagement on one end to policy on the other end and advocacy in the middle. And like one person cannot do all of that. So like, I think one of the, one of the questions that Robin asked, like, how can we be an ally to our communities or whatever? One of the ways we can do that is to find the people who are experts at like each of those stages and engage, because like, I don't know how to get something out to the press. And it's not even a skill that I feel like I should develop, that's someone else spent their whole life developing that skill, and I can just ping them and plug them in to my network. So.
Yeah, I mean, I think that gets to what Robin talked about, the multidisciplinary nature of this work, right? So it really extends beyond sort of anthropology, sociology, and biological science expertise to communication and press and all that stuff, right?
And it also circles back to, I think, Susan, this might have been one of your first questions asked, which is, Harvard doesn't have always the greatest of reputations in the space of thinking about how to work with its community. And so I think a lot of that is the kind of burden, the weight that we carry as scientists sometimes in the field, thinking that we have to do it all because we are at Harvard. And we don't. Like, we can actually leverage the power of the name of Harvard to actually help create networks, and actually be able to connect our community members into these different spaces where we can amplify their voices. So I appreciate that. You and I feel the same way, because it's been hard to like kind of get into the communities that we're trying to work with, because there's some distrust there. But I think in the space of, just to give the example, the reason why we're talking about personal care product chemicals, and it's a super fund, project, which was focused on metals, is because the community was very clear. They wanted to learn more about personal care product chemicals. So we couldn't leave that on the table. So it was about connecting them with the materials, the resources, the people, and also communicating about metals. So, yeah.
People just need to see their cool first XRF gun, then they'll be all into the metal.
I know, we're looking forward to it. We may be working with the Boston Nature Center this summer to do some of this work. So it'll be great. Well, I know that we've been on for 2 hours. If there aren't any additional questions, I just want to give a round of applause. Thank you so much to all of our speakers. This was really phenomenal. It was a great opportunity to learn more about how to do this and what's going on in creative and innovative ideas. So thank you so much for taking the time out to speak to us today.
And on a really tight timeline.
This really was great. So hope to see you at a future Spark event.
Yeah, I mean, this is one of 3 in a series. So please stay tuned. The next one's in April. And we'll be doing a series a little bit on resources available locally within the Harvard Chan community to help facilitate community-based research. But
yeah, thanks to all of you, and also Tamara, Susan, and Jamie for pulling this all together. This is great.
Wonderful. Thank you.
You all stay warm.
Thank you.
Bye, guys.